Space discrimination perception is the second part of the test. This just includes counting dots, finding a position of a dot within a box, finding numbers within a box, and counting cubes that are stacked in different positions.
VEP, ERG, is another way to detect Alzheimer's early in the disease process. The ERG pattern and that visually evoked potential test are commonly used to test in ophthalmology and optometry, and they just estimate the bioelectric function of the retina and the optic nerve. The patterns that can be observed in early Alzheimer's include a delay in the N35, as you can see to the right side of the screen, the P50 and the N95 components, and that can also be accompanied by just a general reduction in the amplitude of those peaks. A reduction in the B wave can also be noted, and that is just due to the reduced number of ganglion cells that are present in the early Alzheimer's retina. It is important to note that while these findings have been reported in a number of clinical studies, they have not been proven to be contributed to Alzheimer's disease, and patients with Alzheimer's disease have normal VEP and ERG findings that do not meet these qualifications. Therefore, this cannot be used to confirm a diagnosis, but it should be used just to help you determine if there is a possibility of early Alzheimer's. Curcumin is just an ancient Indian herb that has been studied for many years for its antioxidant and anti-inflammatory properties, as well as its lipophilic property. It can be used to help early diagnosis and even possible treatment of Alzheimer's. The herb is lipophilic, which means that it's able to cross the blood-brain barrier, which is important while studying the eyes because it is allowed to get into retinal circulation and bind directly to those amyloid plaques in the retina and the brain. Its anti-inflammatory properties are important because they reduce that chronic inflammation, contributing to the breakdown of the nerve cells, therefore slowing the loss of cognitive function and nerve cells. There was a study done by the Indian Academy of Neurology on the effects of curcumin on Alzheimer's disease, and the insert is found in that journal down to the left. And what they found out was basically that the levels of beta amyloid in the mice that they were testing were given in low doses of curcumin, and the curcumin decreased those levels of beta amyloid by 40% in comparison to those mice that were not treated. In addition, they found that low doses of curcumin also caused a 43% decrease in the so-called plaque burden that these beta amyloids have on the brain of the mice. Basically, they just found out that the curcumin was breaking up the existing amyloid plaques. Now, while this was done on mice brains, and it cannot be directly associated with human brains, I think that we are on a step or a new frontier of finding possible new treatments for Alzheimer's disease. Curcumin can also be used just to help aid in early detection. Lucky for us, the herb fluoresces in certain lights, which allows us to use it to label those plaques and detect them in the retina. This allows for a high resolution and, more importantly, a non-invasive way to visualize the plaques in the retina. Current studies have also been tested on the technology in mice, as I mentioned before, in that Indian Academy of Neurology, and they found that the early detection studies in those mice were 100% sensitive and 80.6% specific. What that means to us is that it tested positive. All people or all mice who had the disease tested positive, and most people without the disease tested negative. So that proves to be a pretty safe test for early detection. Now, the safety of the drug in and of itself, or the herb, it is natural and safe when used as a diagnostic tool and when used limited. Chronic use can have some problems such as liver toxicity, and that's usually if you exceed about 10 grams per day. So as long as you stay within those 10 grams per day, it's typically considered a fairly safe herb. Now, it can interact with other drugs such as NSAIDs, Risperin, and blood thinning agents. So if patients are currently on those, you might want to communicate with the PCP and see if there's any way that they can get off of them for the early detection studies, or if you should go another route. The herb is also not recommended for people with biliary tract obstructions, gallstones, obstructive jaundice, and acute biliary colic.
All right, so just to wrap this up, we're going to talk a little bit about how we can change the lives of those with Alzheimer's by just making adjustments in their homes and maybe even where they work, or just things like that. So one thing that we can do as healthcare professionals is educate our patients on these things. So increasing the lighting will help them to be able to see certain objects and avoid bumping into things. Natural light is best. Obviously at night you can't have natural light, but avoiding just really harsh lights, yellow lights, things like that. Avoid patterned carpet and upholstery. Florals specifically are confusing compared to geometric shapes. Probably avoiding any type of shape at all and just having solid colors just helps people find the floor and differentiate it from furniture. Eliminating clutter on the ground is going to help them prevent trips and falls or losing things. So just making sure their house is really tidy and everything is put where it needs to be. Alzheimer's patients have an increased light sensitivity, so just reminding them to keep sunglasses on them and to wear their sunglasses. Color contrast, just to go along with the patterns and such. It's important to have their dishes to be brightly colored and their utensils, just so that they can be able to see it in contrast with their food and the table. It'll just help make things easier. And this goes the same thing for whenever they're picking out glasses. It's sometimes if they like the color red, let them pick out a red pair of glasses and they'll be less likely to lose them. And these are our references. Thank you.